Hi everyone, my name is Nayeli Morales. I will be presenting on Fibrodysplasia ossificans progressiva, or short for FOP. And I will be presenting this for my physiology class, section 30005. Okay, so basically, this is the outline for the presentation. I will talk about what is FOP, what triggers it, how it happens, what causes it, the types of FOP, symptoms, diagnosis, treatment, along with other information. Okay, so let's talk about it. FOP is a genetic disorder that turns soft tissue such as muscle, ligaments, tendons into bone. This will cause a restriction of movement on the patient. It is very rare, only 1 in 2 million worldwide, and here in the US, it is 0.88 per million US residents. It is not more prevalent in a gender, geographic, or race compared to other diseases such as in diabetes, and it is a progressive disease. And a lot of these ones are sporadic, and only of them are heritable. So meaning they only a short amount of them will really be passed down. And the reason is because a lot of them unfortunately pass away before they get to mate. However, if they do mate, then there's a possibility that these diseases could be passed down. Okay, so what happens to the body? We have some images here on the left. And as I mentioned, it is hardening of tissues. Um, and you will usually start at the upper body, down to the trunk, and then to the limbs. Some tissues will be the exception, like that's of the diaphragm, the tongue, and also those that are orbicular, such as the lips and then the eyes as well. Also, forgot to mention on the last slide, but other tissues that are exempt from this disease would be smooth and cardiac. However, it is not the case for skeletal muscle, as we will see shortly. Some other traits are malformation of the great toe. It is commonly known as bunions on children that had just been born. Bunions usually happen to adults that develop it throughout their life because they were a very narrow shoe. Okay. Now, this is very important because it will help with the diagnosis of FOP. We'll go to the next slide. Okay. So it is sometimes referred as the second skeletal system, and the reason being is because this bone will be formed outside of an actual skeleton. These will have spontaneous, painful soft tissue swelling, injury or trauma, intramuscular injections, which is very important because certain things such as biopsy won't be possible with this diagnosis, because when you're doing a biopsy, you're perforating the skin, right? You're trying to get a sample of that tissue. So this will result in trauma or injury to soft tissues, therefore bone formation. So we don't want that. Um, Other things that will trigger FOP are infection, muscular stretching. So very strenuous workouts would cause bone formation. Falls, fatigue, illness, and the proper or medical word for bone formation is heterotopic bone. Okay, so before we go any further, how does it form, right? But I will first explain what it should look like in a healthy individual. So you guys here at the top can see a happy muscle, right? In a healthy individual, we will have a muscle. Say they're working out using a dumbbell. When you're working out, you cause micro tears, and that is how muscle is formed. And when we are born, we have stem cells. These stem cells, they differentiate to form specific cell types, which will then form specific tissues and serve a function. In this case, there would be myocytes, right? So if you have those tears, those like small micro tears, they will come into play to regenerate the tissue. And as you guys can see on this very last image, it's like it never happened, right? Everything will go back to normal. However, in this not very happy muscle or individual, right? We will have the muscle, and they don't necessarily have to be lifting. They don't necessarily have to be working out. They could simply be walking and maybe they hit something or they catch a cold, and this muscle that needs to be regenerated, instead of having those stem cells have myocytes, these osteocytes, which are bone cells, will come in and regenerate this broken muscle, as you guys can see here. And on this next slide, I have on the left what a microscopic picture of what it should look like on a healthy individual. And then to my right, I will have a microscopic picture of someone who has FOP. Okay, now we will talk about the cause. So this is due because bone morphogenic protein, which is a receptor, is overreactive. But the reason why this receptor is acting up is because there's a gene mutation. This gene mutation is a single letter change at the position R206H. Okay. And there's different types of mutations, which could be C-SID17 mutations and C-SID17GA non-mutations. So basically what it means, it will be at a different part of the same gene. The mutations will be a mutation in the nucleotide, where the non-mutations would be a change in the actual amino acid, okay? And the mutations and non-mutations will lead to two different types of FOPs, which we will talk about shortly. But before we do that, I put here to the left an image of what a ACVR1 receptor or gene, sorry, should be doing. But when it is mutated, that autophosphorylation doesn't really occur, so it kind of makes it stick together. Okay, so the types of FOPs, we already talked about them. This one right here is the one with the nucleotide change, and this one over here to my right is the one with the amino acid chain. Okay. So basically, that typical heterotopic ossification and grade 2 malformations we already talked about. Other traits of this first type are sparse scalp hair, absence of finger or toenails, cataracts, or retinal detachment. For the second time, it is slightly different than what we just described. It will either be minimal or no obvious malformation except for the bunion, and or adult progressive onset. What that means is that they will start to have these bone formations later on in life. And those who have severe malformations can either have like reduced digit or just like complete absence of fingers. So in addition to the symptoms that we already talked about, the swelling, the pain, the bunnying, and the reduced mobility, there's other ones. So one of them would be the hearing impairment, difficulty eating and speaking, and this is specifically if the bone formation starts to form at the jaw. Now, again, it restricts movement, so this will cause the person not to be able to eat, and then they'll be able to lose a lot of weight because of it, which is not healthy. Another one would be thoracic insufficiency, and this will greatly impact the survival of people who have FOP. And the reason is because it will restrict the expansion of lungs because of that extra bone that's surrounding the rib cage. So it will cause problems breathing. Another one would be hot to the touch. So they won't necessarily feel hot flashes, but like if you touch them, they'll feel like it's really, really warm. Another one is cognitive challenges as the disease progresses. Scoliosis, as I remember, it'll be like a curvature of the spine. Kyphosis, which is like a hunchback, right? Or like a curvature in the upper back. Pregnancy complications, this is only applicable to those who are able to find a mate and procreate, right? And if they do happen to have a child, a C-section would be necessary because the joint would fuse together and it would be very hard to get the baby out of the mother, right? Or through the birthing canal. Another one is stiffness of the joints. As we know, joints have different functions. They can glide, they can rotate, and because of this disease, unfortunately, they'll have a lot of stiffness. Okay, how is it prevented? Well, it's not really prevented. This is a progressive disease, and it's not like, oh, I'm gonna take a vitamin, I'm gonna prevent this from happening. It is a generic disease. However, you can prevent the progression of this disease. And the way you do that is by restricting physical activity, which this is not really ideal because people kind of lose their independence, right? Other or better ways to continue with the prevention is by physical rehabilitation, and these will help people to get through their daily activities without really hurting themselves. Another one is ambulatory devices, and this will probably be a need if you're getting older, right? Because those muscles um, will start to become bone. Um, Another one is shaping the environment. So, for example, if you live in a two-story house and this person who has FOP lives upstairs, you might want to make those changes and have them sleep on the first floor rather than the second one, so they don't really have to be going up and down the stairs, right? We don't want to cause any falling or any injuries. Okay, how is this diagnosed? Um, as I had already mentioned, the bunions at birth is very, very important, right? Because it can also be diagnosed with other diseases, and we do not want that. So the bunion will give us a hint. Another would be the heterotropic bone. So as we saw those images, it will be like very obvious. Well, not necessarily obvious, depending on the severity of the person, but they will have protrusions on their back. Okay, so we need to look for that too. Other ones are at risk and also genetic testing. But this is just optional. It will only be done for people who already usually when they'll have a kid and they want to confirm if they'll have this disease. This is when genetic testing can come into play. Treatments. For these treatments, there's no cure, unfortunately. So what we will be doing is trying to reduce um, how fast bone is formed in these tissues. I already mentioned physical therapy to prevent injuries, harm. Another one are corticosteroids, and this will basically help with the inflammation of the bones or of the tissues. Now, palovarotene is a fairly new medication specifically made to treat FOP, and we will talk a little bit more about that. So this right here is a graph that I grabbed from the Association of FOP, right? And the medication, there's a bunch of here listed. The one that I mentioned on the last slide is the one here, the very first one. This is a bit outdated. It has not been updated, but basically it just shows different medications that they're working on and the phases that they're on, right? Like the clinical trials, phase 1, 2, 3, 4, rollover approved, and palovarotene was approved. So basically, it should be all the way over here. And these second to last and third to last were stopped. Okay, prognosis and honorable mentions. So this disease is also known as Stone Man syndrome, and you can already guess why, right? It limits some mobility, so you're kind of like a stone, you're kind of like a rock. The average that a person can live on this disease is about 30 years. And the person that has lived the most or the longest with this disease was 54 years of age. Now, when people continue to live to their late 20s, it is most likely that they will use some kind of ambulatory device. So, like a wheelchair, for example. And as I mentioned earlier, most die of complications like thoracic insufficiency syndrome. There isn't really an outstanding or well-known celebrity, and my guessing is that they don't live that long. Usually, when someone becomes famous, you gotta develop some kind of skill or something, right? And because they can't really move, they're restricted physically. Um, there isn't really a a celebrity. However, I did found two people that are kind of like social media influencers, and their names are Zoe Buxton and Joe Such, and they basically talk about what their life is like living with this disease. Now, a history lesson. How was this discovered, right? So, in the 17th and 18th century, there were documented cases of this disease, but that's about it. There wasn't really like a treatment or anything of that sort. In 2006, the University of Pennsylvania discovered the single gene mutation that we talked about earlier. Remember those two that makes um, two different types of FOP? Yes, those genes. In 2014, phase 2 of the clinical trial for palovarotene started. In this phase, they started to give the medication to adults, and then they began enrolling children to then give it to them. Now, in August 16, 2023, not too long ago, this medication, palovarotene, was approved by the FDA for consumption. And that's basically it. These are my references and the pages that I used to get that information from. And yes, thank you for listening.